Why do doctors use EMG to diagnose EMT? Doctors use electromyography, often called EMG, to diagnose muscular dystrophy. This test measures the electrical activity in muscles and the nerves that control them. By doing so, it helps doctors distinguish between muscle diseases like muscular dystrophy and nerve disorders that can cause similar symptoms. Understanding this difference is crucial for accurate diagnosis and treatment. During an EMG, a fine needle electrode is inserted into specific muscles. This electrode records electrical signals when the muscle is at rest and during contraction. In cases of muscular dystrophy, the muscle fibers show distinct changes in electrical activity. For example, there may be a reduced response to repeated stimulation and abnormal motor unit potentials. These findings indicate that the weakness is due to a primary muscle disorder rather than a nerve issue. EMG is particularly valuable early in the diagnostic process. It can differentiate muscle diseases from nerve or neuromuscular junction disorders that might mimic muscular dystrophy. This differentiation is important because it guides further testing and treatment options. Additionally, EMG helps identify the pattern and severity of muscle involvement. Doctors can test both proximal muscles, which are closer to the body center, and distal muscles, which are further away. This comprehensive assessment provides a clearer picture of how muscular dystrophy is affecting the individual. Moreover, EMG can guide further testing, such as muscle biopsy or genetic testing. By indicating which muscles are most affected, it helps streamline the diagnostic process. It also aids in excluding other conditions that cause muscle weakness, which improves diagnostic accuracy. While EMG cannot specify the exact type of muscular dystrophy, it confirms muscle involvement and supports the overall diagnostic pathway. It is often used alongside other diagnostic tools, like blood tests that measure creatine kinase, a marker of muscle damage, genetic testing, and muscle biopsy. In summary, doctors utilize EMG in diagnosing muscular dystrophy because it objectively assesses muscle electrical activity. It distinguishes muscle disorders from nerve issues and supports accurate diagnosis and treatment planning. This test is a critical part of evaluating patients who present with muscle weakness consistent with muscular dystrophy. Always consult healthcare professionals for personalized medical advice and further information.